hire me lor.
I'm Serene. I'm a Senior Patient Service Associate in AMK Specialist Centre, which is a part of Tan Tock Seng Hospital. I have been in this line for 8 years.
Never heard of this actually before.
You mean like the reception in the hospitals kind of thing, is it?
It sounds like, frontline. So maybe at the counter they will deal with service for the patients. But generally, you kind of assume that all these people are all nurses because they are dressed in similar attire as well.
Like serve the patients, like help them, maybe in terms of giving them food and all. Is it?
We are kind of like frontline staff lah, yeah, but we are not receptionists. Because we do a lot more than receptionists, yeah. We actually do patient care, we do registration for patients, ensuring all the personal data are correct. We assist doctors as well, including like chaperone, arranging future appointments for patients, follow through all the referrals and follow-up. Training as well for newly joined staff. I actually have a chance to learn about venipuncture, which is blood taking for patients. I actually do visual acuity, like eye check tests for eye patient, as well as measuring their eye pressure. I do financial counselling for patients as well. It depends on actually what kind of disciplines we are in. I was actually from medical oncology, so I actually have to know about like chemo drugs as well as the regime, and also the different payment schemes for chemotherapy. I think as long as you work in like maybe hospital clinic setting, the uncle auntie will always call you Missy. So they think that you are a nurse and then you know everything about like medical things lah, yeah.
You can do those things with like a normal degree, or is that engineering or STEAM kind of like degree, then you should probably be okay. Yeah.
I feel you don't really need much qualification. I guess basic, like be able to understand English. For some people, Chinese and the mother like Tamil and Malay. Being able to comprehend a conversation with people. Then I think the rest just go through a course and then we'll teach you what you need to know to help the people around. Personally, I don't think you need much of a qualification, just a heart to serve.
Yes. I was actually graduated from a private diploma in business admin, so it's totally not related. Yeah, but we do have on-board training. This class actually teaches us about Tan Tock Seng systems, and we do service and clinical training as well, like how to transfer a patient from a wheelchair to a chair. We also have preceptor assigned to us, so that we can actually ask them for help if we need. As long as you have the heart to serve and willing to learn, to me, yeah.
Hire me,
because now not everyone wants to work in the healthcare sector because of the risks, especially in this period. The long hours, the sacrifices that they need to take every day.
So lesser and lesser people join the industry, right? How do you think it will happen?
Then we'll hire more foreign talent in that sense.
There's a high demand for medical needs, right? And we don't have manpower. I think it's really going to be a strain on everybody. I believe there'll be more restrictions and measures in place just to suit the limited manpower needs. So personally, for me, to those who's doing their part in the medical sector, I really appreciate your hard work and your effort, and I believe many of us will feel the same too.
We really need a lot of people in the healthcare sector because if like one day really lack of manpower, right, it will be very draining and overwhelming. Because like in Singapore, aging population, we have aging populations. So we are thankful for those who appreciate us. Yeah. Even I'm working for 8 years now, right, I still think that there are a lot of things that I can learn and grow on this job. And moreover, I think that healthcare sector is constantly innovating in terms of medical care and technology. So actually, I'm quite excited what future lies ahead lah. If you have the same aspiration as, you can join us.
Hire me?
Hello, I'm Serene. I'm actually a patient service. Sorry.